Well, good morning, everyone. It is 11:35, so I'm going to go ahead and kick us off to keep us on track. My name is Sherry Corey. I am the West Mountain Regional Health Alliance Board Chair. I am also Director of Development and Engagement for Contexture. For those of you that are not aware, Quality Health Network is now known as Contexture, and we serve the state of Colorado and the state of Arizona. So happy to be here with all of you. And thank you for joining us. This is our first quarterly meeting of 2026. Woohoo, I can't believe we're already here. 2026 is upon us and it is cold. So welcome everyone. We have a great agenda planned out for you all today. We've got some great speakers that are joining us to give some updates in their expertise. And I'm really looking forward to hearing from each one of them. But again, thanks so much for being here. We appreciate your partnership, your collaboration, and just coming together quarterly so we can talk about all things West Mountain. So Christina, I'm going to hand it back over to you.
Thank you, Sherry. Again, it's great to see faces and names and people I haven't seen in a while and some new names and faces. And so if it's your first meeting, would you be willing to share that? Put up your hand or I know there's some new people in here. That's okay. I don't want to put anybody on the spot, but I think there are some new folks in the room and we're glad to have you. Oh, I see one.
I can go. My name is Lindy Kenlin. I'm with the Trailhead Institute and I lead a workforce programs and initiative called Colorado Public Health Works. We are a apprenticeship and community health worker training program.
Awesome. Nice to meet you. Thanks for coming. Great. Well, thanks everyone. It's good to see everyone. And I'm gonna just share some quick updates about West Mountain, and then we're gonna go into some really awesome presentations today from a lot of folks, just to get an idea of what's happening at the state level, and then to discuss how that sort of trickles down to our level as well. One moment, and I will share something other than the agenda. So one second. Easier said than done. Um, Karina, could you share my slideshow that's in the quarterly meeting folder?
Yep.
Thank you. Well, first of all, for those who were able to attend our 10-year anniversary, thank you. That was a really special night, and I want to thank the staff and the board and some of our partners who made that possible. That was really huge, and now we're in year 11, so we'll see what the next 10 years bring. Thank you so much. Okay, next slide. Well, our last quarterly meeting was in July, which seems like kind of a lifetime ago. And then we had the event in October. So we are trying to do some virtual and then some in person. And so that's really our goal with these types of things, especially when we're hearing from our local folks like we did at the July one. All right, next slide, please. So we've worked really hard on our strategic plan, and that's probably going to move from 26 to 2028 because it's big work that we're trying to do. Strengthening the health system around access to health and resources around social determinants, food and housing, and some of the key things that are the challenges of keeping people healthy and able to thrive. Data is a big thing. We're going to show some data from our Valley Alliance to End Homelessness, some really great numbers that our groups are doing. They've really stepped up, and we've got a lot coming ahead with the homeless initiatives, as well as some data that will come from the Mountain Coalition and Food Nutrition when their gaps analysis is ready to be shared. So we really want to continue this, having these conversations with you, leading and being part of that. Funding is a huge factor this year. As we know, the funding climate is very difficult for nonprofits and specifically around health access, food, and housing. And so really looking at what we can do to help fund those issues and also fund our backbone work. And finally, just continuing to become the board and our organization being better at governance and better at what we do. Any questions about that or thoughts? Okay. Thank you, Christina. I appreciate that. All right, next slide, please. Yeah, so I just wanted to share about the gaps that were identified. And like I said, there's going to be a report that's going to come out when that is solidified. Mobile pantries and mobile markets, 72-hour food totes, and home delivered meals for adults. And so I want to shout out to McFinn's and to the partners and to a lot of you. There was a lot of mobilizing during the time when the federal budget was happening because SNAP benefits were not going to be provided. They were provided later on, but because of that budget, that was happening. And at the same time, that created an impetus to raise the awareness of how much the need around food is. And today we've got Feeding America from the Colorado office, as well as Sue Ellen from Food Bank of the Rockies to talk about some of those things as well. Next slide. So next slide too. So the Valley Alliance to End Homelessness, go ahead and this is in September of 25. We had a really big meeting with the state, with Built for Zero partners, and Built for Zero is sort of a movement and a framework that we've followed around data and case conferencing to get people housed more efficiently. And so I think this kind of was an impetus to get us moving together in an even stronger way. All right, next slide. So I'm going to share, in just a moment, I'll share some of the recent slides that this is. This is not quite released, but it's designed for our region, and we were the first region to get something like this. So all of our providers enter into the Homeless Management Information System, which is a requirement of certain state and federal funding. And so with that, we have a really clear picture of who's experiencing homelessness, who's at risk, and this is going to be really great to be able to access this information quickly and, pretty cool. Okay, next slide. So the other really great thing that I want to celebrate is, I think I saw Hans on here and Indira and some other Health Solutions West, but Health Solutions West was chosen as our service provider for permanent supportive housing. And so we're still in the initial stages, but we should be officially starting very shortly. So this is for chronic homeless, and we have to find affordable housing units. So there's some housing navigation, and then they get ongoing supports to help them stay housed. This is an evidence-based process, and this will be the first actual permanent supportive housing in our region. And so that's, super exciting. And we want to say congratulations to Health Solutions West, and we're excited to work with them on this important project. I personally am super happy about this because I've been beating this drum for a long time. Those of you who know me and who've been part of this forever, we've all been working on this, so it's exciting news. Okay, next slide. This is just a little bit about models. So because of our cost, we're not doing a single site at this time, but we are doing a scattered site. And so we hope to do this to be able to show that this could work in our region, and then that could build to potentially doing a single site in the future. But this does achieve 80 to 90% housing retention and reductions in ER, shelter, and jail use. If you talk to our law enforcement and some of our providers, you understand that these individuals sometimes are the ones who are most using the system. And so if we get them housed, it actually saves money, which is awesome. And we have people housed and able to move forward. And so it's exciting to me. Next. I'm not going to go into this too much, but this is just a little bit about what helps people choose the support. And yeah, so next. Finally, I just want to do a shout out. We have a really awesome community resource directory and resources, and I want to say thank you to Berta Rivera because she has made such a difference. Berta has left the organization. She is going to be working for the City of Aspen Police Department, so we're sending her congratulations. But the new resource directory and work will continue. We have hired a new regional health connector, so we're super excited about that. Next slide. Just more info on the resource guide. We do have these flyers available. So once our new person starts, that may be one thing that this person is doing, is coming around distributing flyers and getting to know you guys as our partners. Next slide. I really appreciate what Berta did and worked with our web person to create a more user-friendly version of this. And so, and a lot of you gave feedback on that. And so that's really, really amazing. We're getting a lot of views. We're adding folks, and this is all free and low cost information. Okay. Next slide. So just continuing, building on what we've done, telling the story. I think that's going to be important. And I'll share one thing that we're working on that'll help with that. And then creating systems improvement and impact. This is a tough time. We want to be able to continue all the important work we're doing, but we're all facing fundraising difficulties, crunches in funding availability, and just a lot of I don't know about you, but things change so quickly that it's hard to stay up to speed, which is why this meeting is really important. And along with hearing from our awesome speakers, I want to hear from you guys about, things that you're experiencing that would be helpful to share with the group. And so it's just an important time to stay informed, but also stay sane. So it can be challenging because a lot of things are coming at us at once. Next slide. Thank you for being here, and I just really appreciate all of you and all the work that you're doing, and let's keep it up. All right. The other couple things I wanted to share, we're not going to get too far into these. So this is, oh, if it shares, there we go. This is a most recent from our database that was pulled. So this is total served, and the time frame is in 2025. So 372 people were served through the Valley Alliance to End Homelessness. That equals 288 households. And so you get a sense of where it is county, each specific county, and then there's some other information. Additional things, we have 22 veterans that are served, 109 chronic homeless, and 167 that have reported a disability. And so I think it's really awesome to have some clear aggregate information about what's happening within our Valley Alliance. This is our exits, and I may have Karina explain this fully, but 223 people, 127 households, And this is for the past year as well. Karina, can you explain that a little bit more clearly than I can?
Yeah, so the one I actually have there is exited to permanent supportive housing, because we try to calculate exited to housing. And so here are the numbers in the time period of 2025. Like Christina said, were exited to permanent supportive housing. That would be 223 people and 127 households and broken down by county there. Was there more you wanted me to go into?
Oh, that's great. And I think I just want to clarify, these are permanent housing, not supportive.
Correct.
Okay, thank you. And then finally, this is a little information on active currently, and this only reflects a point in time, like right now. So, right, correct, okay. And so these are people that are being actively worked with to find housing and help them if they're experiencing different things. Any questions about that, or just things you'd like to know? And like I said, there will be some version of this available in the future, and we'll be sharing out things as we can as well. Okay. Well, I really appreciate all the work that the state has put into this and that Karina and Mike and Keith just to get us to this point. They are using us as a model for other regional dashboards in the future, but we're the first group to receive the work. So that's awesome. Finally, before we hop in, because I want to hop into our speakers, I wanted to share this will be out soon. This is a paper that we are working on around SNAP benefit cuts, rising health insurance, and all the things that we know are happening in our counties. And so, just to give a couple things, we're gonna talk about some of the have this available. This way we can use it for presentations, partners can as well, and just kind of really tell that story about what's happening in our region. And so I will be sharing more about this soon, but here's kind of some of the things that we're gonna talk about and the big pressures. SNAP, not just SNAP, but food security, health insurance increases, and then housing and the other costs of living and how these things are affecting most specifically our region. So be on the lookout for that, and we'll talk more about that in the future. All right, I've talked enough. So, any questions before we get into the meat of our conversations? Okay. Well, without further ado, I want to introduce a couple of our speakers. So first off, I would love to introduce, one second, sorry. I haven't memorized your bios yet. Sorry, guys. But so first off, I want to introduce Caitlin Snyder. Snyder. I think I'm getting that. Caitlin is the outreach director at the Colorado Fiscal Institute. She leads community education, outreach, and advocacy efforts on Colorado's most pressing fiscal policy challenges. She has over a decade of experience in voter engagement, community and partner outreach, coalition building, and civic engagement. She really works to ensure that CFI's research, advocacy, and community education is led by and directly impacted community members. Caitlin provides strategic guidance as part of the CFI leadership team to advance policies that create a more equitable economy for all Coloradans. I don't know why that's hard to say, but it is Monday, so I'm gonna give myself. And then following that, I also want to introduce Joshua Mantell, who's the Director of Government Affairs for the Bell Policy Center. He started in 2018 as the Rapid Response Policy analyst and works with the research team, assists with communications and outreach. Prior to the Bell, Josh was at the Wilderness Society in Washington, D.C. and Denver, where he worked on public lands, energy, and climate change. Um, he also worked on Congress, focusing on sustainability and energy conservation. So both of them are great resources. They're going to talk a little bit about what's happening fiscally and really get us a sense what's happening with the budget and ways that we can move forward together. So, all right, Caitlin, do you want to start?
Yeah, I'm happy to. Thanks, Christina, and hi everyone. Josh, do you want to do slides? Excellent. Awesome. Well, I'm really excited to be here with my colleague Josh Mantell, and we are, like Christina said, we are here to talk about really January is a great time with both the start of the legislative session and the start of the new year of talking about what is Colorado's current landscape and our fiscal landscape. When we think about the budget, when we think about how we prioritize all the things that we need to do for our communities. And so at the Colorado Fiscal Institute, we really are a statewide organization that focuses on how we can use research and legislative and ballot advocacy, strategic communication, and statewide education to advocate for tax and budget policies that really help drive forward a people-centered economy. So when you think of CFI, we are the nerds, the tax nerds, along with our partners at the Bell. And Josh will introduce himself after I get through these slides. So really what I am going to be doing right now to help lay the groundwork before we get into the next steps of what we can do is talk about our fiscal landscape and the fiscal situation that we are in currently and that we have been in a really tight budget years where we are making cuts to programs while also having all these other funding threats at the federal level from decisions that we are not able to make. And so how is Colorado responding? So to start us off really for this groundwork conversation, let's take a look at our state budget. And when we look at our state budget, Colorado works with a $43.8 billion budget. Okay, and it's made up of three different buckets. We have our general fund, and this is the fund that our legislators have the most discretion over that we'll be talking about in the next few slides. But we have also about a third of that budget comes from federal funds. And as the name suggests, this is really the pot of money that's made that comes from the money that we get from the federal government. And so all of these dollars come with a specific use. For instance, our Medicaid expansion dollars or transportation funding. These dollars come into the state and they are here for a specific purpose, right? Determined by state and federal law. And so that's about $14 billion of our budget. And then another third of our state budget comes from cash funds. And when you hear cash funds, think of fees opposed to taxes. All right, so cash funds are specific fees charged to a specific group of people for a specific purpose. How many more times can I say specific in a sentence? Think cash funds. They're very specific, right? So when you think about cash funds, think about like motor vehicle fees, right? These are the dollars that we pay when, you buy a car and you have to register it each year. And that those fees don't go into our general fund. They don't pay for healthcare or childcare, right? They actually go to pay for transportation, right? So DMV and other transportation services like roads. Another example is like our fishing license fees, right? So when people go fishing, they pay to get a license, and these are used to really fund fish preservations or wildlife. So you can't really raise fees on farmers and use it as general purposes. That's what this general fund is for, or about the $16.9 billion that we have in this pot of money in our general fund, right? And so if we think about the general fund, like I said, this is the most discretion. This is what our legislators are tasked to do every legislative session, is to look at the amount of dollars in our general fund and create a budget. All right. And so next slide, Josh, if we think about the general fund of what that money is made up of, about 2/3 of it come from income tax, right? Most of it come from the individual income tax that we collect from individuals when we file our taxes. And then the other part of it comes from corporate income tax or other, investment income that we create. 1/3 of it comes from our sales tax, right? Our state sales tax, not our local sales tax. So these are all the funds that we collect as a state to fund the general fund. Okay. Our sales tax, our state sales tax is 2.9%, and our individual and corporate income tax are 4.4%. Something to keep in mind as we talk about these next steps of what we can do. So if we zoom in on what does the actual general fund buy? What are the priorities when we ask our legislators to come together every legislative session? They have to create a budget. And so this is a breakdown, a broad breakdown of general fund spending. Like I said, we work with about a $16.9 billion general fund this year. And we know if we look, about 30% or almost a third of it goes to K-12 education and early childhood funding. Okay. Almost one third of it, 32.8%, so almost 33%, goes to healthcare. And this is really Medicaid costs, right? Where Medicaid costs, the state puts in money, where we get a 50%, or where we put in 50% and we get 50% from the federal government to pay for traditional Medicaid. And then our Medicaid expansion, we put in 10% and the federal government puts in that 90%, right? And so one thing that's really interesting and something to note is that healthcare costs of our general fund has outpaced, the last 2 years have outpaced the money that we've put towards education. And so that's for the first time ever, that healthcare is our largest piece of the pie, right? And so this has been an ongoing debate at the legislature over the last couple of years, and will continue to be a conversation as we are going into another very tight budget year where our legislators are asked to make cuts. But we have to remember that healthcare costs, we're not just overspending in healthcare, right? Healthcare costs have outpaced inflation for years, knowing that healthcare is expensive. The cost of providing healthcare for all of our Coloradans is more expensive, and we want to make sure that we are providing healthcare for everyone. We know that the utilization rate is up because of our aging population, right? And so when we look at this amount of money that we're spending on healthcare, Colorado is ranked 44th in per capita state spending, right? Where we're investing only half of what other states are investing per person for healthcare. So something to keep in mind as we look at this general fund of like how we split it up. 10% of our general fund goes to higher education, and we know higher education costs are on the rise, and we continue to make cuts of what the state can provide. Corrections is at 8%. Human services is at 7.8%, and that's really the admin side of a lot of the safety net programs that we have. And then everything else is about 12.6%. All right, so we take a good look at like what our legislators are up against. The pie is really small. It's not growing in the way that we need. And we know that, we are having these really difficult conversations at the legislative level of when they are making next year's budget. We're looking at about an $840 million budget deficit. Where they're coming in starting January this year, where they have to figure out where to make those cuts. Even though we have been in a budget deficit for years, meaning that we have not been able to keep up with the cost of inflation and caseload growth, where we've had to continue to make cuts. Right. And one of the big reasons that we are continuing to be in a budget deficit is our tax code, is what is in our Constitution, that are the rules around how we collect revenue and how we can spend it and how we can raise revenue. And that is the Taxpayer Bill of Rights. There's Article 10, Section 20. And I'm not going to go in depth about Tabor today, but I just want to make sure that we all have a good understanding that Tabor is one of the biggest constraints of why we continue to be in a budget deficit situation where we are not able to keep and collect all of the revenue that we're bringing in from those state level sales tax and state level income tax, right? And so Josh, if we go to the next slide, I'll just do a quick overview of Tabor. At the Colorado Fiscal Institute, we really examine our tax code and the rules around it. And we have broken down Tabor, although there are many, many, many more provisions to it. We have broken down into these 4 major provisions of what Tabor does for the state and how it's been holding us back. And so one of the major provisions is that it strips the legislature from the authority to make tax policy decisions. We know that we cannot increase any taxes. We cannot create a new tax we cannot go ask the voters if we can go and be in debt for a little bit, unless we go to the vote of the people. So our legislators do not have that ability. They do have the ability to look at our tax code and how we're using tax exemptions, but they do not have the ability to make any tax policy decision that increases or creates new revenue. Tabor also prohibits our tax options to raise revenue. When I talked about, our income tax, both our income and corporate income tax are 4.4% for everyone, meaning our lowest earners are paying the same income tax rate as our highest earners in Colorado, 4.4%. All right, so Tabor has a sentence in it that prohibits income to be taxed in any other way. It has to be taxed with one single rate, meaning that we cannot put into effect like a graduated income tax that many other states use, our federal governments use, and at one point in time, Colorado has used. Tabor also sets election provisions, meaning it tells us when we can have election. It says, yes, we can have odd year elections as long as it pertains to Tabor. It also mandates how it shows up on the ballot, right? And so anytime we want to increase revenue, it has to start with shall taxes be raised. The fourth major provision that I want to talk about, which we'll get to in the next slide, is that it ties the state's hand with a strict revenue cap, meaning we have this arbitrary cap on all of the income or all of the revenue that we collect. And it says anything above that cap, we have to return to taxpayers. And so that is something that we haven't been able to keep and collect money when we've been bringing in more revenue in years that our economy has been booming, or we've been getting more, federal relief like from ARPA. And so, Josh, if we go to the next slide, in the state of Colorado, when we look at our current budget situations, this chart is really big and complicated, and I'm not going to go through all of it. I'm just going to point out a few things on it. But this is the amount of fiscal year spending that we bring in every year, going back to 2011 into the projected years of fiscal year 28. And so right now, in the current budget year, we are under the Tabor cap. We are about $464 million under the Tabor cap, meaning when our taxpayers file taxes for 26, we will not see any Tabor rebates. Okay? And this is something that I want to note because it limits the ability for us to have any kind of budget cushion. And so everything that we pay for that through our tax code is now in competition with all the things that we pay for in our general fund. And one of the things I want to mention is some of these important tax credits that go to our working families. And the Family Affordability Tax Credit is one. It's a fairly new credit that was implemented and passed in 2024. Our families were able to first receive it last year when they filed their taxes for 24. And in combination with this Family Affordability Tax Credit, Earned Income Tax Credit, and the state level child tax credit, it cut child poverty by at least 40%. So these really incredible tax credits that we have in place in our tax code, this year, 2 of them are turned off. The Family Affordability Tax Credit, our families will not be able to receive them. All right. And so that is something that we are trying to address and know that it's, on top of cutting programs in our budget deficit, we also have to cut these tax credits that go into the hands of our lowest earners. And so our legislator this year, when they started this legislative session, they are tasked to create a budget for fiscal year 26-27. And so we are above the Tabor cap. However, like I said, our legislators are starting off with an $840 million budget deficit, meaning our budget has not been able, the revenue that we collect, we have not been able to keep up with the cost of inflation or the caseload growth that we see in this state. So we are above the Tabor limit as our legislators are making this next budget, but we are still having to make cuts. It just doesn't make much sense. Our tax code is not making much sense to us. And so on top of this, we are, when we look at our tax code, and Josh, if you want to go to the next slide, of both like being in this budget deficit situation, Colorado, we have an upside down and regressive tax code. The impact of our tax code. So this chart, little wonky, but the overall message, when we look at all taxpayers in the state and we look at the share of income, the percentage of taxes paid, we see that the highest earners in the state are actually paying a smaller percentage of their income than the lowest 80% of Colorado earners, right? And so this chart, it's broken up into quintiles, right? So 20%. If we take all of Colorado's taxpayers, split them up into 5 groups, the top group is actually split up even more, right? The top 20%. So it's the highest 15% of earners, 4%, and 1% of earners. And so Tabor and the constraints that we have, the rules that govern our tax code, have really caused this upside down and regressive tax code. And there's been a lot of other, looking at all of the decisions that have been made at the federal level that we have not had the ability to have any input on, really. When HR 1 passed, when we look at HR 1 that was signed into law in July, there was 2 sides of it, right? There was the spending side where we are making big cuts or putting work requirements in for Medicaid, for SNAP, and for other important programs. While the tax side of things, we are giving the wealthiest corporations and wealthiest earners big tax breaks through deductions. If Josh, you go to the next slide, the impact in Colorado, if we look at that same, all of Colorado's taxpayers, we know that the richest, the wealthiest 1% of Colorado earners, so those who are making over $863,000, they've received about $71,000 in tax savings, while our lowest earners only receive $70. That's 1,000 times more. And so this, we know HR 1 has exacerbated our budget shortfall by these giant tax breaks that we gave to the wealthiest earners in Colorado. Because we know in Colorado, not only are we unique with Tabor, the Taxpayer Bill of Rights in our tax code, we are also really unique in the way that we are connected to the federal tax code. We are a rolling conformity state, meaning that any changes at the federal level, Colorado automatically absorbs. Right. And so we are seeing big impacts of HR 1. Last year, we saw big impacts when HR 1 was passed. Not only were we giving these tax breaks to the wealthiest Coloradans, but our budget took a $1.2 billion hit. And so we had a special session where we tried to help mitigate some of that harm for our budget. And so we're seeing those different effects. And so we know in Colorado that our tax code, Josh, if you want to go to the next slide, really leaves us vulnerable to any federal changes. It limits our flexibility because our tax code, the Taxpayer Bill of Rights, is within our Constitution. We can't make changes very easily unless we go to the vote of the people. And we know that right now, the way that it's set up, we are not bringing in enough revenue. And so, kind of like, doom and gloom at the moment, and we've been in this situation for a little bit. We know at Colorado Fiscal Institute and with many of our partners and some of our legislative champions, this year during the legislative session, not only are we trying to help protect some of our safety net programs, but we're asking our legislators to take a look at our tax code. And so what we can do to make sure that we aren't just giving tax breaks to the wealthiest Coloradans and we aren't leaving behind our working families. And so at CFI, we have a pretty robust legislative agenda through 4 different tax bills that we're really looking at figuring out how we can help make sure that we are not leaving behind or making our tax code even more unfair. And so, Josh, if you go to the next slide, we want to continue to look at how we can decouple from HR1 provisions. So decisions that were made in HR1 that we were not able to do, that Colorado's tax code automatically absorbed, of looking at how we can decouple, or meaning how we can detach or delink from those provisions, how we can make sure that we're holding corporations accountable to paying their fair share, and really looking at how we modernize and clean up Colorado's tax code. So, like, really make sure we are centering our lowest and middle earners, and so that we can put that money to fund that family affordability tax credit, which will be turned off when families file their 26 taxes. And so we know we want to make sure, our tax code should be lifting everyone up. And at CFI, that is one of the things that we are really here for, in a really hard budget year, of how can we make sure we're not just cutting programs and also giving tax breaks to the wealthiest? How can we make sure that we are putting more money in the hands of our working families? And so that is just kind of, I'm going to hand it over to Josh, and he's going to talk a little bit more about some of our budget constraints and these next steps after the legislative session, once we do some more tax cleanup of where we can go. And so this is a slide, we don't have to go over it, but join us, be in touch with CFI and the Bell Policy Center. So Josh, I'll turn it over to you right now. And I think I stayed within my 15 minutes.
Thanks so much, Caitlin. And just really great kind of baseline level of context for all of this stuff that's happening at the state level. And I want to get into a little bit of some more of the specifics and also how we think, along with our friends at the Colorado Fiscal Institute, how we can fix some of these problems for the long term. So, as mentioned, my name is Joshua Mantell. I'm the Director of Government Affairs at the Bell Policy Center. For those of you who don't know the Bell Policy Center, we are a nonpartisan, nonprofit advocacy and research organization focused on improving economic mobility for all Coloradans, regardless of race, ethnicity, and zip code. We do work in a whole bunch of areas, including a robust aging agenda, housing, the caring economy. But obviously, we're here today to talk about tax and fiscal and how we can improve some of the funding at the state level in these systems that we know promote economic mobility for all Coloradans. So just to kind of go into some of these numbers. So last year, the legislature was forced to cut about $1.2 billion, again, because of that Tabor limit not keeping up with the economy and the rising costs of healthcare. Then we had a special session just this last summer that our friends at CFI really did a lot of really important work on cleaning up our tax code after the passage of HR1. But we also had to dip into our reserves as well as cut specifically the Medicaid provider rate, as well as some funding for our higher education institutions. And then, as Caitlin has mentioned, we have a projected $841 million deficit going into this budget year, 26-27, that the legislature will have to figure out how to close in the next 3 or 4 months. We talk about a lot of these big numbers, and I think sometimes when we give these presentations, people's eyes kind of roll and say, I don't understand what $841 million actually means. So I'd like to put a little bit of kind of people to the numbers to kind of explain what that actually means in terms of the people of Colorado and how it works there. So we are 50th in the nation in teacher wage competitiveness. That is dead last. When you're comparing our wages for teachers to the cost of living in the areas that they work, we are dead last. And studies given to the independent studies given to the state legislature last year showed that we are $3 to $4 billion behind adequacy in our K through 12 education system. So not just $3 to $4 billion behind an amazing K-12 education system, but below an adequate public education system. As mentioned, we have our healthcare costs that are rising faster than inflation, and we have a significant aging population, which leads to higher long-term services and support costs, those costs that go to home healthcare aides, to nursing home facilities, as you all probably know much better than I do. We have a childcare system that is no longer accepting new families, low-income families into the system because we don't have enough money to continue accepting these children who need it and their parents who need to go to work. And need someone to watch their children and care for their children and develop them so that they are ready for our education system. And then we had significant local transportation cuts this last year through the legislature. Those of you on the Western Slope and in the mountains probably feel that significantly more acutely than some of us over on the Front Range. But those were significant in how the legislature were able to balance the budget without cutting Medicaid and public education last year. I'm not sure we can be as fortunate this coming year because we have really cut. Most of everything that could be cut that wouldn't significantly and directly impact our major programs here in Colorado. And so we'll likely see a dip into the Medicaid program, into our public education program, and further into higher education and some of those core priorities. And this doesn't even mention what we're looking at into the future. So, HR 1 significantly cut SNAP as well as Medicaid, the Supplemental Nutrition Assistance Program, as well as Medicaid starting in 2027. We're going to be losing billions of dollars in Medicaid funds through the next several years, as well as the cost of actually standing up and administering the work requirement system that is mandated as a result of HR 1. I do want to get into some of the more rural and mountain impacts of HR 1 and why it's such a devastating hit to a lot of communities out on the Western Slope and in the San Luis Valley. And even on the Eastern Plains. And the reason for that is, as Caitlin so eloquently mentioned, the federal government cut taxes for our wealthiest population, which is mostly centered in our urban areas like Denver, Boulder, El Paso County, and into our mountain resort communities. And they did that, and they were able to fund that by cutting eligibility to Medicaid and SNAP. And of course, our rural populations are disproportionately on Medicaid and SNAP. And so you see here in Garfield County, for example, 22.5% of the county is on Medicaid. And if you look at it here, the mean family income, you can see the stark differences between the Front Range. You can see Douglas County right here, and Elbert County, Arapahoe County, Denver, Boulder, Broomfield, some of our more wealthier communities, and it much less on the Western Slope here and on the Eastern Plains. And so this was a huge wealth distribution, HR 1, from our rural counties to our more urban and mountain and suburban counties. And that is going to have devastating impacts to our, whether that's, rural hospitals closing because they cannot get the Medicaid funding that they had been relying on to keep their doors open. Or even if they don't close, we'll see likely a fleeing of the providers there who no longer can afford to stay in those counties because they are not able to actually keep up with the cost of providing the services that are needed in those areas. And so we did a piece on the rural impacts of HR 1 that I'm going to put in the chat here in a minute that I would welcome folks to read and really kind of highlighted this wealth redistribution from rural to urban that we saw in HR 1. And so you may be asking, these are some really devastating impacts. We're really seeing a crunch. What can we do? What can Colorado do to fight back and create our own future apart from the federal government so we're not quite as reliant on this fickle and chaotic work that is being done on our behalf at the federal level? And so we have a new coalition of which Colorado Fiscal Institute and the Bell are a part of. You can see all of the groups here on our steering committee. It's called Protect Colorado's Future. And I think it's important to note that these folks come from a wide variety of issue areas. We have fiscal advocacy groups like ourselves and CFI. We have healthcare groups like the Colorado Consumer Health Initiative. We have reproductive rights groups and environmental groups. We have childcare groups like the Colorado Statewide Parent Coalition and the Colorado Children's Campaign. We have labor folks. And we're all came together because we realized that the budget problems that we are facing hit all of our issue areas in some way, shape, or form. And we've done a really good job in Colorado of kind of tailoring certain ballot measures to provide for certain program areas, whether it's free school meals, domestic violence survivors, sports betting for water projects, all important issues. But we need a more holistic look at our tax policy and our budget policy in order to make sure that we are not just funding the most politically popular programs, but funding everything that Coloradans rely on in order to meet their needs. And so what we are proposing and proposing to put on the 2026 ballot is a graduated income tax. Right now, as Caitlin said, Tabor is a major constraint on our ability to fund these issues. And one of the things that is in Tabor is that all income must be taxed at the same rate. So whether you're making over $1 million and you have two homes in Vail and Aspen, or you're just trying to make ends meet and living paycheck to paycheck out in Grand Junction, you are paying the same percentage of your income in taxes. And because of the tax breaks that are available to those high earners and not available to those at the bottom, what we've seen, as Caitlin so put up in that chart, is that the wealthiest among us pay a significantly lower rate of their income in taxes than everybody else. And so we need a way to balance that out to get to a fair tax code. And so we're proposing tax cuts for 97% of Coloradans, all Coloradans making under $500,000. We're going to do that by cutting the first $25,000 of an income and then cutting again up to $100,000 in income. And then we will be proposing to raise rates on the top 2 to 3% of income earners in Colorado, those making above $500,000. Again, as if you make that first dollar above $500,000, all of your money is not taxed at that new rate. It's just the money above that. This is what marginal tax rates is. 27 states in the country use this. The federal government used this. And Colorado had a graduated income tax in place until 1987. And then in 1992, it was enshrined in our Constitution through Tabor. This would not change any of the Tabor rebates, money over the cap, but we would be raising about $2 to $3 billion more of revenue to be put into healthcare, including Medicaid, mental and behavioral health, food security systems, K-12 education, including teacher pay and money going directly to districts to help them offset the rising costs that they're seeing, and then childcare, not only childcare, but also early childhood education as well. And really being able to bolster those programs so that we can provide for Coloradans who are needing this and bring down costs for folks across the state. I don't have to tell you folks that healthcare premiums are rising exponentially right now and really causing a lot of financial issues for people across the state. If we could invest more in healthcare and bring down those premium costs for folks, that would be a really big improvement to affordability throughout our state. If we can improve teacher pay, that's a really important improvement to affordability across our state. And the same with childcare. Having a second mortgage basically being a childcare cost is just unaffordable and inaccessible for too many folks across our state. And so investing in those programs and the workers that work there will improve economic mobility for folks across our state. And so, I'm going to put as well a volunteer form in the chat for folks who want to get more involved in this. We will start collecting signatures here on this measure in the next 4 to 6 weeks, we're hoping, and really working to put it on the ballot for 2026 to really improve our budget situation and the lives of many across our state. And so with that, this is my information. I know Christina will be sending out this slideshow to folks after the fact. So please feel free to get in touch with myself or Caitlin. Happy to answer any questions and certainly happy to answer any questions that you may have here now. So with that, I will stop sharing my screen.
Actually, you went so fast, Joshua. Can you put that back up?
Yes, I can.
I'm just not that fast.
Sorry about that.
Thank you.
Oops, here's contact information for folks.
Thank you, Caitlin and Joshua. I'd love to hear questions and thoughts. That was some great information and really helpful to understand some of the challenges. Joshua, would you share kind of what will be the process to potentially get this on the ballot by 20 this year?
Yeah, happy to. So, for folks that have not been in the ballot world, there are two routes to get something on the ballot. You can get a measure referred through the legislature, or you can file through the Secretary of State and get it on the ballot through what's known as the Citizens Initiative process. Um, we are not going through the legislature to do this for a variety of different reasons. We're going through the Citizens Initiative process. Um, so right now we have just gone through our first hearing at the title board, which is how they determine whether a measure has a single subject, and then they write the language that will appear on your ballot as unbiased as possible. So we've gone through that. We expect a rehearing here in the next couple of weeks from some of the opposition who do not want to see higher taxes and increased budget revenue. We are optimistic that we will get through that. And as soon as we get through that, we will be grabbing some petitions to circulate throughout the state. Because we are amending the Constitution, we need to get signatures from every single state Senate district. In Colorado, so there are 35 state Senate districts. We need to get 2% of every registered elector within that state Senate district's vote for a total of about 125,000 statewide. And so we will be, knocking on doors, having volunteers at whatever festivals are in your community, whatever farmers markets are open. And so between basically the end of February into August, we will need to collect those signatures and hope to do that. And certainly feel confident that we will get on the ballot here for November 2026. And then we'll just need that 50% plus one vote in order to enact our measure.
Feel free to go ahead, Jill.
Thank you.
Hi there. This is Jill with the Arc of the Central Mountains. I don't have any questions. Unfortunately, I've been in this conversation for a while now, and I just appreciate everything that you're doing and just really, really trying to make a dent. I mean, there's nothing but dismal news here. So I appreciate all of the work that you're doing, and I'm very hopeful that it will circle back and benefit the state and benefit the people that we support as far as all of our stakeholders are concerned. So thank you very much for all of the work that you're doing. And I appreciate your presentation today.
I appreciate that, Jill. Thank you so much. It is dismal news right now. I think in a lot of different areas of our world and our country, unfortunately. But I think the double-edged sword of Tabor is that our legislators are not allowed to make these kinds of policy choices that we have elected them to do. But the other side of that coin is that we hold the future in our own hands right now. And so we really do have the ability as voters of Colorado, as Colorado residents, to change all of this and to do better. And it's really about choosing the kind of future that we want to see here in Colorado. Do we want to see a future where everybody has access to affordable healthcare? Or do we want to see a future where only the wealthiest and well-connected are able to access those kinds of benefits? Do we want to have a future where, low-income children can't access daycare, childcare, and early childhood education? Or do we want a state where we are preparing the next generation and allowing their parents to be able to go to work and improve their own economic situation through the hard work and the opportunity that they have in front of them? And I think the choice for Colorado voters is pretty clear, and I think they know what they stand with, and it's just about getting the message out and an understanding from folks what the true problems that we face in this state are.
Thank you. Any follow-up questions before we start talking about one of those issues that is part of this conversation around food security? Well, I want to thank you, Caitlin and Joshua, for an excellent presentation that I think puts things in more clearly. And if people are interested in learning more, there's some, we'll send out the slides. There's also some great uh, websites that have been put in there, and we'll try to include those as well so people can learn more if they want to. So thanks again.
Thank you so much, and thank you to all of you for having us.
Yeah, absolutely.
Thank
Really
you.
appreciate it. Next, I want to introduce Ron Meehan. If I'm saying that correctly, Ron?
Meehan. Close.
Meehan, thank you. Close. Okay. Um, Ron is the government relations manager for Feeding Colorado, which is the state association of food banks representing over 1,300 partner agencies across Colorado and Wyoming. Previously, he served as the Director of Government Affairs for the Food Bank of Alaska and manager of the Alaska Food Coalition, where he coordinated more than 250 food banks and food pantries, tribal organizations, faith-based health centers, senior centers, among others. It looks like you've been part of food banks for at least the last 17 years, which is awesome, starting out as a volunteer. And so we're really excited to hear from you and learn more about what's happening. Thanks, Ron.
Absolutely. Thank you so much for having me. Do you want me to share the slides? I did email them to you just before this.
Yeah, if you don't mind sharing, that's great.
Yeah, everybody
You
bear
should
with me
be
here.
perfect to do it. And if you do, if you want us to, I can too. No problem.
Shouldn't be a problem. Just bear with me here.
Of course. And thanks for joining.
Absolutely glad to be here. Okay, let's. Okay. Well, good afternoon, everyone. As Christina said, my name is Ron Meehan. I'm the Government Relations Manager for Feeding Colorado, which is the statewide association of food banks. Want to be sure to start off to thank the West Mountain Regional Health Alliance, Christina and Karina, for the invitation to be here. Our 5 Feeding America food banks are Food Bank of the Rockies in Denver, Community Food Share in Louisville, Weld Food Bank in Greeley, Food Bank of Larimer County in Loveland, and Care and Share Food Bank of Southern Colorado and Colorado Springs. And you can see the way that that breaks down by county among those 5 food banks. There are 1,300 partner agencies that we provide food to across Colorado and Wyoming. It's closer to 1,100 for Colorado. And we really work to engage in local, state, and federal advocacy, and then facilitate coordination and communication between our food banks. I do want to give a huge shout out. I know we also have Sue Ellen here as a guest, the executive director for the Western Slope Food Bank of the Rockies, and she's going to be able to speak to specific impacts to the region and what she's been seeing on the ground. Unfortunately, I will say, similar to some of what we've heard from other organizations, I don't think it'll come as a huge shock to the people here that this is an exceptionally difficult and uncertain time for our food banks and food pantries. And I'm afraid I will also have some bad news as well, but I will also say that we have incredible power when we act collectively. So this breaks down just a little bit more about who we are, what we do, our mission. Again, our vision is a future where everyone in Colorado has equitable food access to the food they need to thrive. We also work really closely with farmers and the agriculture community to identify shared priorities that can both support locally grown and sustainable food while meeting the need of our neighbors. So really one of the most important programs that we offer application assistance for and do advocacy around is the Supplemental Nutrition Assistance Program, which I think increasingly over the last year, so many people have heard more and more about. I will say SNAP unequivocally is the nation's most effective anti-hunger program. It is a massive economic driver, particularly in so many of our rural communities. It supports local retailers and grocers. It supports agriculture and farmers, and then, of course, so many of our neighbors. In the state of Colorado, it's around 615,000 people that are supported by this critical program. I think there are also a lot of misconceptions about who SNAP supports, which, again, a silver lining of a lot of these crises is a greater recognition of that. About 50% of those supported by SNAP are children, about 10% are seniors, and about 15% are folks with disabilities. That is specific to Colorado. For every dollar spent using SNAP, about $1.54 is generated in economic activity. Again, those are local stores and retailers and farmers markets. We know also that for every meal a Feeding America Network food bank provides, SNAP provides 9. So it really cannot be understated the impact that this has. In the state of Colorado, SNAP injects over $1.3 billion into the economy and wages for over 10,000 Colorado jobs. Farmers, grocers, manufacturers, delivery drivers, and there are over 3,100 retailers across Colorado that accept SNAP and are benefited by the program. Oops. I also wanted to take kind of a lot of time to review some of the specific provisions within HR 1 because they are going to have a tremendous impact on state and local decision makers, as we have heard up to this point, as well as so many of the neighbors that our network serves. Again, for every meal that one of our food banks provides, SNAP provides 9. Really, unfortunately, the overarching message is that we as an anti-hunger network are going to be expected to do a lot more with a lot less. We are anticipating really large increases in need and longer lines at our network of food pantries across the state and really across the country. The estimate from HR 1, which passed last summer, is that it is projected to take 6 billion meals a year off of the tables of the people that we serve. Again, those are children, new mothers, seniors, veterans, folks with disabilities, people that are working hard and just not making enough to get by. And really, to put that into context, the entire network of Feeding America food banks across the country last year only provided 5 billion meals. So the gap that is created is actually 20% more than the total amount of food that we have already distributed. Keep in mind that this is coming at a time that our network has really seen significant cuts and rollbacks to a lot of our most important programs that are compounding one another. So the Emergency Food Assistance Program has seen a pretty dramatic decline. I think Sue Ellen will probably get into that, and I'm happy to answer questions if we don't in either of our presentations. But that's commodity food provided through the U.S. Department of Agriculture. That's one of our flagships, particularly in rural communities. So it's about 20% of the total food distributed by food banks, but in a lot of our rural communities, that goes up to 40 to 50% of the total food that gets out there. Our network is really already strained to meet the need, and we have only continued to see an increase in the number of people turning to our network for help getting by. And unfortunately, as grocers and a lot of some of our most important kind of corporate donors in terms of food have tightened up their operations and gotten better at estimating how much they're able to sell, they have less food going to waste, and by extension, we're getting fewer donations of food. So this breaks down a couple of the different specific provisions. We're not going to go into detail on every single one of them. The big ones will be the cost shifts and the work requirements, and I'll go into each one of those in more detail here shortly. The first one is going to be the SNAP benefit cost share. This will go into effect October 1st of next year. Right now, currently as it's estimated, it's projected to cost the state of Colorado between 130. It's Right now, they're saying closer to 135 million. That's based on payment error rate. This is a huge shift in what has been done up to this point. SNAP benefits historically have been 100% federally funded. So it's forcing states to pay a percentage of the cost of benefits based on their payment error rate. This has nothing to do with waste or fraud. Payment error rate is typically transposing errors, or the biggest one is timeliness. So if a county agency fails to process an application in time and get people the benefits they need by the statutory requirements, that actually contributes to their error rate. The administrative cost share historically has been a 50-50 split. So up to this point, states have paid 50% of the cost to administer the SNAP program and process applications, and the federal government has covered the other 50%. Following the passage of H.R. 1, starting this October, states will have to pay an additional 50%. So it'll be 75% total will be paid by states. Right now, the Colorado Department of Human Services is estimating that that will cost the state about $50 million to cover. Um, One of the things that we are really prioritizing in our state legislative advocacy right now is really just making sure that legislators are aware that this is coming and taking the necessary steps to try to address that, whether that be bringing something, a shift in the tax structure via ballot measure, or, what other preliminary steps that we can take to be prepared for this. Something that has already gone into effect is the work requirement changes. So, able-bodied adults without dependents can only receive SNAP for 3 months and then lose benefits for 3 years unless they can find work. Um, that has been the case prior to the passage of H.R. 1, but what H.R. 1 did is changed the criteria by which folks would be subject to these work requirements. So the work requirement age range that is subject has changed both on the lower and the upper ends. Folks between the ages of 54 and 65 will now also be subject to these new work requirements, as well as parents with children between the ages of 14 and 18. This ended up actually being a win by federal advocates within this bill, because they had originally wanted to make it children between the ages of 7 and 18. So any parent that had a child 7 or older would have been subject, and we were able to increase it to 14, which is still obviously a massive number of folks that this is going to negatively impact across our state. But just so you have that context. These will go into effect for SNAP recipients as they reach their recertification period. And so right now, something that is really important is education around these new requirements to make sure that folks are aware. I'm happy to put in the chat after this. There's this worksheet that CDHS is circulating to help spread the news. And there's also going to be additional cost to administer these new requirements, as county agencies and the state will be responsible for making sure that people fall into this criteria. And that's estimated to be around $53 million. Another big change that has happened from the state level is restrictions on the kinds of foods that folks can purchase, specifically a sugary drink ban on SNAP. Governor Polis requested a two-pronged SNAP waiver from the Food and Nutrition Service last year. One to ban sugary drinks, and one to allow the purchase of hot foods. So right now we call it the rotisserie chicken example, where if a SNAP recipient goes into a grocery store and there's a hot chicken rotating on the rotisserie, they can't purchase that. But if you throw it in the freezer for an hour, then they can buy it. That is something that advocates have been trying to roll back at the federal level. Unfortunately, FNS only approved the former. And that is set to go into effect on April 30th, and will include soda, sports drinks, energy drinks, and sweetened tea and coffee. And then I have a list of some of the things that are exempted from that. Similarly to the work requirement, CDHS does have a really helpful one-pager and documents to help spread the word on that I can be sure to put in the chat after this as well.
I know Sue Ellen has to step away. I just wanted,
Oh, okay, yeah, no
um,
problem. I
just
apologize,
one.
Phil, and I don't take up
No, no,
the
you're
time.
fine. You're fine. It's good. I just wanted to give her a chance to say hello and
Yeah.
let people know that she's available
Yeah,
to talk.
actually, this is the perfect slide for me to jump in. Hi, everyone. I'm Sue Ellen Rodwick, the Western Slope Director for Food Bank of the Rockies. We've been working right alongside Ron and the Feeding Colorado team, who's been keeping us updated on all the changes that have happened and are going to happen and the timing. Um, and they were also instrumental in helping us acquire $7 million during the federal shutdown. We were able to, each food bank decided how they were going to distribute that. So Food Bank of the Rockies, which covers Eagle, Pitkin, and Garfield counties, we allocated. So the funds were allocated by county depending on the SNAP issuance. So the dollars going out to each county through SNAP. And we were able to then allocate funds both to for us to distribute more produce. So we're getting out more fresh fruits and vegetables across the region. And then also for our hunger relief partners like Lift Up and Harvest for Hunger to be able to purchase more food to help supplement people that are were not receiving their SNAP funds. So what we were seeing in this region is quite a surge in people going to food pantries and also our mobile food pantries. We have three that happen in this region. In Elgebel, Rifle, and Glenwood, those happen every week. We definitely saw an increase in attendance. And so right now we're still seeing an increase in attendance. I'm not sure if it's because of the lack of snow still or some of the lingering effects from SNAP or also just kind of a fear of being out in the public. But we are grateful for this funding. We've also received other emergency funds. And so we are able to really help. But it's just a drop in the bucket, as you heard Ron say, for every meal that we, or for every meal that SNAP, or sorry, for every meal that we provide, SNAP provides 9. So it's just, we're trying to make up the difference, but it's quite a lot that we're expecting. What we've been communicating, and we got a little glimpse of it during the shutdown, is that we are going to see levels of food insecurity that we didn't even touch during the pandemic. So we're doing as much as we can to make sure we're serving our community with fewer USDA foods and fewer funds, but we're going to show up the best we can. And I'll put my info in the chat if you have questions that you want to ask me directly, and then I'll let Ron finish it out.
Thank you, Sue Ellen. Appreciate it. Back to you, Ron.
And I'm wrapping it up quickly as well. But thank you, Sue Ellen, for highlighting that. The Community Food Assistance Provider Grant is really a critical support with the actions that we are continuing to see play out at the federal level. It is going to be increasingly crucial for the state and local governments to play a key role in helping us meet these high levels of need. So last year that had been funded at $2 million. Right now it's currently, I think, budgeted for $2 million. We're hoping that it could return to the $3 million that it was when it was first sent out, I believe, the year before last. So I do want to flag that we do have a newsletter that we send out, as well as advocacy action alerts when those opportunities arrive. I'm happy to send these slides to you, but then you can either scan this QR code here or go to feedingcolorado.org/advocate. This is just an example during the HR1 debate of one of those action alerts that we were able to provide to our members of Congress. And then we also keep our social media updated frequently as different opportunities arrive. So feel free to follow us there as well. Happy to answer any questions folks have, and then you can also reach me at the email on the screen, and I will put those things in the chat here shortly that I said I would.
Thank you, Ron. I really appreciate your presentation and your time. What questions do people have? And I want to emphasize that I know this is a lot of information, and like we said, some of it's tough, but I think there's some openings as well. So I'd love to hear what any of you are experiencing around some of these issues and just questions you might have.
And of course, I'm always happy to speak with any of you individually or take any questions as folks have them on an individual basis.
One question was, what's the best way to share this information for those on the ground, community health workers? Yeah, I think that's a good question about how, part of it is getting this information out here, but also ways we can share it more broadly. Thoughts on that, Ron? And I can comment too.
Well, I'm not going to dismiss the fact that it is a lot of information, right? These are a lot of significant changes in a very unprecedented way. We haven't seen this kind of a restructuring of kind of core federal nutrition programs in the history that those programs have existed. So I don't want to diminish that in any way. I think that this is going to be something that we're going to need as many people actively playing a role in as possible to try to get this information out. One, obviously, to our neighbors that will be impacted by it and community members and partner agencies, but then also to our policymakers on the advocacy front to ensure that they understand the real world and real people implications that these policy changes are having. Unfortunately, as Sue Ellen has alluded to, we very well could see some of the highest levels of food insecurity in this nation's history. And that, unfortunately, was a policy choice. So, we continue as a nationwide network to look at opportunities to try to mitigate harm. There's a whole bunch of stuff. I wanted to try to keep it relatively high level. There's a whole bunch of other stuff too. I'll give you one example is the local food purchasing agreement was about $5.5 million that went to Colorado to purchase locally grown food that went directly to our network of food banks. That was canceled last year, but there is a bill in the federal legislature to replace that in a more permanent way, the Local Farmers Feeding Our Communities Act. And we have 6 out of the 8 members of our U.S. House delegation on that. So it's bipartisan. There's about 72 co-sponsors total, about 19 Republicans and about 48 Democrats, I think, or something close to that. So, we're continuing to try to identify any opportunities to mitigate harm. In terms of getting the word out, I think it's going to be a catch-all approach. It's going to be social media. It's going to be word of mouth. It's going to be any opportunity that we have to speak to groups like this, we're trying to utilize that.
Thank you. For any last questions or thoughts before we wrap up, and happy to hear from you because, we want to create forums where we can provide information, and if there's future things that would be helpful, I'd love to hear that as well. I won't call on you, though I'm tempted. Okay, well, thanks everybody. Get a little time back in your day. We really appreciate all of you. Thanks to our speakers. You guys really gave us some great information. And we'll definitely be following up and we'll share information for others to follow up with you as well.